lecture in Moscow, stem cell conference, the first international one. And we started seeing all these patients with bio-in-blue, which wasn't unlike BioAlcamid. So these all had to be surgically removed. I sort of had written those up. And then we started seeing problems from sub-Q. It's been taken off the market since. And it was good from us. I got 3 patients from guys that were sent to me. This is one of them. And we were practicing with intralesional steroids and 5-fluorouracil. And there's the difference. 5-fluorouracil actually caused a neuropraxia that lasted about 3 weeks. But again, we were just making up the doses. We didn't really know what to run them at. And even since I've come here today, I've got 2 cases sent to me that my doctors are using intralesional steroids on other patients. So that was the early stages when we were doing that. Then we had all these problems that we considered was possibly biofilm. So if you have biofilm, and I'm not sure still that it doesn't exist, or maybe it does, you have 3 problems. The first thing is you have the hyaluronic acid forming a complex collagen shield around itself. The second thing is it gets infected. So if you're going to treat it, you have to treat it multi-dosed. So you've got to treat the infection, which we usually use clarithromycin. You've got to break down the collagen with intralesional steroids, and you've got to use your hyaluronic acid as well. So in the early stages, we were, I suppose, using higher doses of hyaluronic acid than they were in the United States. And then I was arguing, I'll show you later, against higher doses. But I didn't realize in the States that they were using Hylenex with 150, even though they didn't have the problems. And we were using 1,500. So we had 10 times the dose. And at their prices, that was costing them thousands. But anyway, this was back then. It's when we were figuring out how to deal with these problems. And if you're using depamedrone, which I'll show you later, and hyaluronic, Hyalase. In Britain, we use Hyalase. In Germany, they use Hyalase without the A. And in the United States, they use Hylenex, which, so it goes on like that. So, and then this was from Miami, where I used to work. And this lady here, she had horrendous problems, We had worked with us and with the craniofacial unit in LA. Brian Boyd is a colleague of mine from Northern Ireland, and he did a replacement. And that was her in Saudi medicine. And the other patients from Newcastle, she had necrotizing fasciitis, and they both have autologous hemifacial transplants.